All right. Well, welcome again. Appreciate y'all coming to listen to our uh, financial effectiveness series on strengthening healthcare performance. I know you all have extremely busy schedules, so I do not take that for granted, and really honestly appreciate the fact that you take the time out. Today, I'd like to I get really excited. This actually is one of my favorite topics, and I'll share with you why, because it's been a lifelong learning for me. But again, welcome. We're going to have a lot of fun today. Hopefully, you call productivity standards fun. Yes, that's a little geeky, I know, but that's a little insight to who I am. Um, Honestly, I tell you this subject, I don't know why, it's just been this lifelong quest about really truly right sizing and understanding the why for over 30 years now. Um, I started this journey out probably in the mid 90s with a product called Mecon. Really was an opportunity for me to try to introduce benchmarking to our organization, and so along this path, I think I've probably tried over 20 different type of products and methodologies and thoughts, and this is a culmination of that. So without really further ado, let's get into it. I'm really excited to share with you and just get your feedback. So let's start off with a fun disclaimer. For this is basically general purposes. This is really going to be educational, so not a lot of factual data in here. Some information that truly or really that meat of examples. Yeah, a little bit more data is behind it, but nothing that is you can find anywhere. So I've tried to protect the innocent and not share the guilty, so to speak. So again, thank you. I know many of you have joined us for now the other two sessions, now this one, the third, and those that are just joining us now, again, everybody, welcome. This is one of the most crucial conversations I think hospital leadership can have. The structure of this today is really focused on that senior leadership, controllers, operational folks, but really anybody that has an interest in, again, rural healthcare. That's my specialty. That's where I've lived most of my life and understanding, have done some PPS work, but most all of my time has been in a rural setting. Even though today I live in Tucson, Arizona, my heart and soul is rural America. And so I still spend most of my time doing that. In fact, right now I'm doing a CFO position up in the Pacific Northwest in support of an organization that is really trying to find the right path. So it's actually a lot of fun. So overview, what are we going to talk about? Well, we're going to talk about why productivity matters. Why should it matter to you? In your organization, what is this productivity standard and what is it not? And I think that's equally important to understand the two differences between that. How realistic labor standards really are developed. In I say realistic, I'm going to put that kind of in the air quote. I'll probably do that a couple different times throughout this presentation as to why. Why am I saying realistic labor standards? How leaders should use productivity information, and then really the rural department case study. So this is trying to get really down into that level of in the weeds so that you can at least get a flavor of what I'm talking about. And then practically at the end of the day, so what? What are your next steps? What should you be thinking about in terms of aligning the goal of productivity towards responsible stewardship and using that labor resource or that capital human asset to its fullest potential while still maintaining that sense of financial effectiveness and long-term sustainability. This is not a one and done quick fix, and it's not intended to be. So I think you'll hear that throughout this conversation. So why this session? Number one, need to connect workforce strategy to your mission and sustainability. If you don't do that, it will fail miserably. It will be a CFO, decision, and then the lack of support, it's just not sustainable. But you always want to connect it back to who you are. So the very heart of your culture of what you're trying to become. And I think you'll hear that in my voice. You've heard it in my other presentations. That's really critical to me, is that proper alignment. It's not just about the numbers. It's really about the people. Clarifying the board's responsibility, what's senior management's responsibility, and then ultimately leadership's responsibility towards it. So we'll outline that, and then we'll really strengthen leadership's understanding about the future planning, the why. So again, what does this productivity mean? It isn't, and I thought this was actually cute. I put this up. That image on the far right is actually an AI generated. I did that. So it's kind of partly me, partly not me, but don't make me use my CFO voice. So I'm going to tell you and you're going to respond to it, right? And so it's kind of like that whole mom and dad, don't get me angry. And then I definitely not trying to be the CF no. So no equipment, no staff, no raises, nothing. So really this influence of you're going to have to do more with less, just suck it up. That's not what we're going to talk about today. This is really about how to create the right environment so that your stewardship of productivity, that human capital, actually melds into the service of your mission. So productivity work is not an end in of itself. I'm going to tell you that right now. It needs to support who you are. What's your strategic aim? Where are you heading to the future? It's a process of learning. And I have a diagram as we move forward in this as talk a little bit more specific. Thoughtful staffing helps balance the patient experience to affordability and ultimately that long-term viability. So we all want to remain consistent. The graphic I try to use here kind of aligned to the triple aim kind of experience, but really it's about that patient experience, maintaining your cost, servicing your community, and in a way that you can remain viable long term to create that whole mission stewardship partnership. Popular approaches. I am not going to knock these, but we've seen all the headlines across the nation, mass layoffs in the U.S. healthcare industry, closures of rural hospitals, leaves patients scrambling for care. And they're challenging times, without a doubt. And we're going to be faced with that over the next several decades. So my hope in introducing this is to provide you the best opportunity to right size your organization for financial stability. Not going to say that you should never think about cuts. I personally am challenged by those. I think that's, if we didn't plan, but there are things that happen. I mean, we think about when COVID hit, many of us were like, okay, all of a sudden our volumes dried up significantly, populations, and, the hospital I was working for at the time, a significant amount of the population left because it was a university town. That one had huge influences. We weren't overwhelmed with volume, we were underwhelmed with it. And so, what were we going to do? We really tried hard not to lay off anybody. And so, we had to come up with a plan. But at some level, you're trying to preserve the organization as well. This is more about framing up a longer term strategy so that it becomes part of your culture. So that's what we're going to talk about. That's why I want to start with what is your why? Why are you doing this? Why are you even considering this? Why did you join this today? So I feel this quote is one of the most powerful quotes. I share this routinely because it's really this development of the shared vision. As counterintuitive as it might seem, then the best way to lead people into the future is to connect with them deeply in the present. The only vision that holds are shared visions, and you will create them only when you listen very, very closely to others, appreciate their hopes, and attend to their needs. So what do I mean by that? I mean, when you're developing this, this is an opportunity truly to sit down with not only your senior leadership team, but your leadership team and understand what's their concerns. Well, what are their reservations? What things are they most proud of? What things do they see that could be improved so that you're really truly beginning to identify not only the organizational goals, but where are they at and where do then ultimately do you share the vision collectively? Because that's where you're going to get the traction. From that vision then comes really your current reality. What are you facing? What are you trying to accomplish? Maybe there is a burning platform. Like if we don't, well, we're down to 10 days cash on hand. If we don't make changes today, we're going to be in a lot worse position. Now, that's a tough decision, but maybe you're truly saying, okay, we don't have that severe of a burning platform, but we know the challenges ahead are daunting and we want to be in front of that. Therefore, in order to manage our capital needs, whether it be replacement of equipment, whether it be recruitment and retention of employees or new providers or expanded services, whatever that might be, maybe as part of your organizational goals to provide safer environment so you're improving your quality outcomes. Maybe you're looking to improve your employee net promoter scores as a result. So how do all of that reality then play into what you're trying to develop within this productivity model? So that's how, you got to start shifting from that vision to where are we at today, and then how do we then want to proceed to the future? So again, laying this groundwork. Now, labor, why am I talking about labor in this particular series of the five pillars of financial effectiveness? Because it's our largest spend. Or a service industry. It's not the one all end all be all, because we're talking about revenue cycle improvement. We've talked about provider relationship and contracting, so these are important aspects. This is one more additional piece within how do we create this environment to be sustainable for our community. So that's why I'm focused on this. There are other opportunities, definitely. We'll talk about those in future endeavors, but today we really want to talk about this productivity and why labor matters. This slide I did deliberately. Yeah, what do you I mean by that? So there are four bullet points here. Why four bullet points? Well, when you go to talk about managing productivity standards, it often comes across as a four-letter word. I mean, honestly, I think most of you probably at some level are chuckling as a result, but that's true. It's just there's just this oh blank. What are we talking about here? Are you going to make my life miserable again? You're going to make me do more with less? No, this is really about forecasting staffing relative to your volume, identifying variations within the lines of services you do. And what does that mean? And how do we really protect one another? You've got the danger when you're talking about productivity standards to start to create silos in an organization. What do I mean by that? If I'm over in this area and serving this population, and you want to pull me over into another department, well, that cost is coming out of my cost center and I'm responsible for it. So therefore, I'm not sharing. And that's that whole silo. I can't work collectively. That's not what we want to do. We want to tear that down. We want to look at organizationally, how do we manage that? So collectively, again, financially, we can be sustainable. So it's hiring right, it's scheduling right, it's looking at opportunities for process improvement, but using data to drive many of our decisions. It supports your overall objectives from your financial plan, your budgetary standpoints, etc. So those have to be in alignment. So again, it's not an end in of itself. It supports your affordability, that access, sustainability, helps rightly size your organization as you begin this endeavor. So this, I don't know if many of you have heard of Peter Senge. He is a business. Okay, he created a book, and he wrote a book called The Fifth Disciplines. It's really speaks about learning organizations, and this really has fostered my personal goal of this personal mastery, this ongoing learning and adapting and in order to thrive long term. So the framework of much of what I am presenting is really spawns from that lifelong learning journey. So personal mastering yourself is to lead yourself, inspire others, and really transform healthcare within this learning position and where we are today. I like to think of this as creative tension. I used to have a slide. It had, rubber band and two fingers pulling on each side of it. I wanted to kind of change that a little bit to maybe be a little more visual, but think about that band that is actually flexible in where we are today. If we do nothing, then there's little we will improve because there's no tension, there's no desire to change. However, if we look to the organization of where we want to be in the future, that's our vision. That's where we begin to create this tension. Now, if we put too much tension on the organization, we will end up stressing out and burning out our employees, and eventually it breaks. So you just have to know what's that creative tension, that right amount, right in the middle of which is driving us to the future. And as we move to the future, we maybe put a little more tension on, maybe we relax the other a little bit. So it begins to continue to move you along this visionary path. So I feel like that's a nice illustration. We're going to use it throughout this time again, that creative tension. So we know we aren't where we want to be. How do we get there? That's the creative part. We need to create transparency in this process. If we don't do that, we will end up, people will not support it. So this is just an example of things you might consider, whether it be a dashboard or some KPI that you're developing along your path. So you might be measuring your labor costs as a percent, your worked hours to FTEs, your agency costs, some of these things that really are driving your decision making. But really, again, what I want to reiterate is how do we communicate this across the organization so that we're focusing on the right trend lines. We're making the right decisions. It's contextual. It means it's understandable, and therefore we able to ask the right questions as a result. And then, are we making progress at the end of the day? And if we're not, do we need to change it? So this is your opportunity just to question a few things of where you are. So, are you staffing for today's demand? I bet many of you are probably, yeah, we do. We know what the volume is today, but are you also thinking about tomorrow's strategy? Where are we going? Where's the healthcare leading us? What's the next 5 years look like in terms of the one big beautiful bill and the Medicaid reductions that we're likely to spend? How do we manage that in this environment? So you have to have eyes on both sides of that. Where are workforce pressures limiting your growth or access or your quality? Do you have them? Maybe you don't. Which labor trends are temporary? Which ones are structural? What do I mean by that? So if you're having a real tough time recruiting, is it because of lack of? Therefore, that might be more structural. It might be more, community related, or you just, or have a short time when somebody's out on family medical leave, or they had some procedure and they're out, and you're trying to backfill that support. So those should be equally driving and balancing this equation of productivity. What investments could improve long-term productivity and retention? I think our biggest challenge in rural America is making sure we got good quality people and they stay and they're happy. And so it's really how do you create that environment where really salaries and wages are the non-starter. They're not talked about much because you pay fairly It's mainly you appreciate and there's opportunities for growth and definitely opportunities for appreciation for what people are providing the community. What support does management need from the board in terms of board backing? I will share with you along my personal productivity timelines. When I first introduced the thought, I did not have the full administrative support. Well, great idea. Really thought this will help drive our financial results. We were looking for financial results, but the whole concept of productivity was not equally shared across the administration. And therefore, it was a CFO-driven decision, and it is why I'm a learner and I will accept responsibilities that I learned a lot. It did not work well in the organization. So I had to reframe it to right size it and culturally align it. So, what productivity, and we talked about, we're going to share what it is. Well, it's a relationship between the true workload and staffing. And when I say that, I'll get in a little more refined into the weeds. When I put together productivity standards, I'm looking at two components. Of course, the non-productive time, so those hours of sick, vacation, et cetera, in which the employee is not at the facility servicing the patient load. I want to understand what that is, but I almost put that on the secondary review. So is it what percent? And no, so my clinical areas typically were 9 to 11% non-productive time typically. And so we would allocate that pro rata share and kind of understand what that might look like. I was more concerned with the productive hours. So that staff time where you have regular pay, overtime pay. So when people are actually there servicing the workload itself. That's the standards that I'm and why I called it a productivity standard. Well, makes sense now, right? But you can begin to see that relationship. It's a realistic understanding of your labor expectations. It's built from a historical view. So as we begin down this path and we go through the why and we make sure it's culturally relevant and we start to have conversations, I actually don't bring in the historical view until we've had the opportunity to talk about the standard itself. So it's designed through dependable results over time. You shouldn't be changing this every month. Now, it doesn't mean it doesn't change. You're always open to conversation, but it shouldn't change all the time. I mean, if you're changing the target all the time, nobody knows what to shoot at. So consistency becomes critically important. What it is not, and I think this is equally important, um, it is not layoffs. People will think as soon as you start talking productivity, you're trying to cut staff. It's not true. It might be that we're trying to manage staff so that we are more financially efficient and effective in time, but it definitely shouldn't be a strategy to get rid of people. If it is, it will be a really tough road. It's not across the board cuts. It's not a substitute for quality and service expectations. What do I mean by that? You shouldn't lower your standards just because you're talking productivity. In fact, you should be thinking about how do we improve them. So how's that whole process improvement help uh, attach productivity to outcomes? And then it's definitely not a micromanagement tool. It is a tool. All is it? It is an opportunity to question. And that's exactly what we want it to do. So where we're going to start is, and one of my, lessons learned throughout time is to take and move away from raw data, just unweighted patient data, whether it be a patient day, maybe it's a test, how many visits. That's the raw data, right? It can be misleading. And so I really want to move to a better understanding. And why I share this the way I have in this process of learning, I remember having conversations and with clinicians, and they're telling me that, well, I'm seeing sicker patients and they're taking more resources and time and I'm like, well, all right. How do I know that? And how do we measure that? And what does that really mean? So truly sitting down and starting to take this information and guide it through a path in which Not all visits or procedures have equal efforts. We need to identify and not ignore any acuity, intensity, mix of patients, age of patients sometimes have quite a bit of comorbidities and other things going on. How do we account for that? And then right size or weight this across, a measure. Example might be in the emergency department, not every emergency visit's the same. It might be a strained ankle, it might be a car accident. Well, those are significantly different. So one visit does not equal another visit, and how do you measure that? So as you come across this, you might have this weighted system. So it's low acuity to high acuity and comorbidities, et cetera. And so you can help develop that. Now, how do you do that? It's a process. It's a really sitting down, having those discussions with that clinical leader and really starting to frame it up. And sometimes this can be a pretty significant amount of time to do so. I'm going to show you an example of how to get started, but there definitely are opportunities to begin to align this with the expectations of the organization and definitely the buy-in from the leader that you're actually working with. And I remember doing this across all of our platform and meeting with every clinical leader, having discussion. Okay, well, how much time does this take? And how much time does this one take? And really beginning to actually frame it up item by item in what we do, even to the point of, my staffing goes out for education. Okay, well, what type of education and how many hours and how many did you used to use? And, is it new? Is it something that was a new requirement the organization has put on you that used to not be there? Okay, that might be a requirement now, and therefore your standard has to change. So you've got to take all of that into account and begin to frame this up so you actually take raw data and then actually make it useful data. Most of the time, I'm seeing this done through, whatever's done within the department. In the best way, personally, I've actually experienced more success is using your charge description master as that point of reference. Those are the things we get paid for, and we track it, right? So it's always trackable and you can actually get through, and it's always structural data. And so it gives you a better opportunity to have better outcomes than to track things manually. And it becomes such an administrative burden, nobody's going to do it. So how are you to develop these standards? Well, again, this right sizing, right? And it's taking this data, air quotes. I told you I would do that with department's real unit of work or what their services are. I like to use unit of service. I don't know why, it's a personal thing, but it's probably so ingrained in me today. That's just where I go to. But it's taking that raw data and then actually weighting it so that it's meaningful to the workload that is being required within every department. Then at that point, once we've established that, now we can take it and go back and we can look at history. That's why I don't like to do it at the front end. I want to say, okay, what do you want credit for? How do we track that? Some areas might actually be required to have one-on-one care, or maybe they're required to be, if there's a C-section, maybe your respiratory therapists are required to be there. They don't have any billable service, so you can't get anything in the CDM, but they're required. So do you provide this ghost CDM in which they get credit for every C-section that they were actually there, so you can build that into their productivity standard? So that's how you begin to use the historical information to frame it up. From there, you're, excuse me, from there, you're looking at highs and lows. Where were we extremely productive and where were we not? Do we know what happened during that period of time? It might have been that maybe you had, two open positions in a department. If that's the case, yes, people worked harder. Can we sustain that again? Remember that whole, you know, creative tension? Yeah, really great productivity. We want you to run at that level forever. Yeah, not going to happen. You're going to stress people out. They're going to burn out. They're going to leave your organization, and then you're going to have problems. So again, it's finding that right sweet spot, right? So identify that best performed, you know, balance. That's what I'm talking about there. And then your operational realities and, developing those department leaders further understanding. That's why you're sitting down and developing this collectively with them. They own it, right? That's their space. They have to understand it. If you want them to actually perform to something, they got to know what they're performing to. So that's how you begin to set the standards and monitor performance moving forward. I will tell you, you will miss it. There will be things that you thought you understood. And then as you get into this, you'll have to reframe it. So it's an opportunity. That's why I say it's not an end all be all. It's really that chance to create the table for which people can come together and have good decision making and discussions collectively. And then ultimately, at the end of the day, we can make decisions based off of it. So this is a flow chart, and yeah, feel free if you want a copy of all of this, just reach out to us. We will definitely send you this. This is kind of that snapshot. You can put it on your bulletin board, just as how do we go through this process? How do we create this environment of where there's multiple procedures? What's the waited time? And so it just kind of gets your mind to get this creative juices flowing. So why does it matter? What's our current reality? Where do we want to be? And then how do we drive accountability for ultimately this improved outcomes where real work equals real data, which equals real results in the end. So let me get into into the meat of it and really talk a little bit more, that's expectation and maybe, this is something you've thought of, or maybe you do it today, or maybe you do it better. I'd love to learn from you. So that's great opportunities for all of us. Here's a case study. So this particular department, uh, again, I've had to reframe this a couple different times. The most recent reframing was because I converted from one EMR to a new EMR, which destroyed all the other standards before. Multiple changes in leadership. And so the old standards, the new leader had no clue because they had never been involved in it. So it was, again, a process to reset. And this is really the how this series has sprung forth. Worked with a young gentleman in creating what was called the financial effectiveness leadership training. So felt, because we wanted it to be heartfelt in our organization, and we wanted to develop a process by which we trained leaders. So we reset all of this, and this is the outcome of one of them. So in this is MR. This is just a small snapshot. We actually took every procedure that they did, giving them credit for everything that they worked on, whether it was inpatient, outpatient, and how we might weigh this. To get this one started, we simply went to CMS and said, okay, we're going to use CMS's uh, relative value unit. We want to use, in this particular case, weighted worked RVU. In some areas, we might have used total RVUs. Other areas, it might have been a whole different RVU value that we established personally, but we collectively agreed that this would be the start of the measure. And so that way, again, all this baseline data, maybe we saw 7,000 different scans in the course of a year, but that doesn't really equate out to the real workload. So we try to then capture into the work requirements as a result of that. Through that process, we then created these dashboards. Um, Specifically here, leadership's responsibility was really to understand what revenue was being generated, what expenses. That's not today's conversation. I'm really focused on the real bottom section here, and that's the productivity side of this equation, so that they were managing their productive time. Again, looking at that regular overtime hours, and here we're actually pulling back in any temporary. So if we have any type of locum coverage or temporary coverage, we're pulling that back in because those are real hard hours and they can often get hidden. And if you don't capture them, you might be showing you're really productive, but your budget's way out of line. Well, because you're spending a ton on temporary staffing. So what are we doing with this information? So based on that weighted average, we said we need a basically a quarter of an hour of productivity for every unit of service that we do in the organization, slightly over a quarter of an hour. And as a result of that, how are they performing year to date? This particular department is right on track. So ultimately, it's like, hey, kudos to you. Thank you by your input, and you can put variables here of the cost to the organization or the savings to the organizations. Some organizations might decide that there might be bonuses based on that. I'm not saying it's good or bad. I personally have an opinion about that. I think that can create that silo effect. So I would prefer bonuses set on organizational goals as a total than departmental independently. Because I think that we're all in this together and we all work hard. So there's my philosophy for the day. But again, it's this department looking at it and say, where do I stand? Now, as time progresses, if they get really busy, this is where the opportunity lies to use the data to say, I'm thinking we need to hire somebody. Well, that FTE variance should be that Q. So if they were down running an hours per unit of service down, maybe it's 0.15 versus their target 0.28, it would clearly show they probably need an extra FTE or two. And so when that department leader comes forward and says, Mr. CF, no, I want to hire, they have data and they can actually show it to you and you can, oh, okay, I can agree with you. We don't want to limit our growth. So yeah, okay, I concur. We should look at that. So it's really an opportunity to use data to begin to make better decision making. On the reverse side of that, let's say they're running at 0.35 and their target was 0.28. Well, they have somebody leaving their department. When they go to say, I really want to replace this, now we have an opportunity to ask, well, why? We're not meeting our standard. What's different? Well, I mean, it's an opportunity. Doesn't mean you shouldn't, but it's again using not emotions to drive your decision making on hiring, firing, whatever it might be. It's actually data. So that's is just an example as you move forward in your collective plan. I think there's flexibility here in terms of cadence. You could do this weekly. I mean, you could do it daily. I think those are more challenging because number one, we made a commitment to employees to do it daily. Either going to low census, you might only have like a minimum staffing levels, and so then how do you make sure you do have people available to come in to support your needs? So you could do it bi-weekly, in correlation with the week following payroll so that there was this ongoing review. Personally, I've always tried to take it to monthly, so it matched up with financial reporting, et cetera. But again, you could do quarterly, annually, just whatever your cadence and your needs. So I think it's very flexible for whatever your organization's desires are. Don't forget there is this fixed component. So you do have fixed and variable. I personally like the idea of moving to some level of variability. So there are departments like human resources, administration. You're going to have the administrator assistant, whether you have 1,000 patients or 2,000. At some level, as things get busier, they might go, we need more support. So those are typically your fixed, and then your variables are definitely your nursing units, imaging. But even in variability is fixed, right? I mean, at some level, you got to have a person there to care for a patient that might come in the door. So you might have some minimum staffing. So there's always this blend of it. But think about it in terms of fixed does not mean it's permanent. Variable doesn't mean it's fixed. So just how do you manage those cross things? And I bring that here only for an example of don't forget both sides of that. But even when I'm thinking of a fixed unit like human resources, some level, the more patient or employees we have, the more they have to do. So there is a component of productivity variability within that you could build. So now that you are there, how do you develop the leadership in how do you begin to forecast the staffing relative to demand? So now's the opportunity to create that and actually develop your standards for your financial predictability. The questions you should be thinking, your leadership should always be thinking about. Is the workload measure still the right one? Do we need to change it? Does something change? Is there variances temporarily or structurally, or did we self-inflict something? I want everybody to do 10 hours of education a week. Well, okay, that changes our productivity ability, right? Is it what the organization is requiring or not? So those are your abilities to begin to say, how does this need to change? Again, it's discovery, it's discussions, it's opportunity for improvement. Why do these fail? Well, I'll tell you, weak or oversimplified unit of service. They become misleading data, leading to wrong behaviors. Your standards are set without operational input, meaning the CFO said, I put my CFO voice on and I told you, so there's no ownership, there's no credibility. And so, of course, it's going to fail. Your standards are used as punishment. Fear replaces learning. And that's tough to overcome. So all of the things are common failures. I have successfully failed at all those. Hopefully, I've learned a lot and now begin to see success long term. So, good slide here to just kind of think about as you go through your process. All right, we're actually getting very close, guys. Appreciate your involvement and staying attentive. So we're going to talk about what next. What's next for you? So you're now ready. You're saying, this is the right thing. This sounds right. I'm ready. Well, first thing you got to do is you got to create the organizational readiness. So create that shared vision. So these are opportunities to start to build that, having discovery times with your leadership team, might even be with your board. Why are we embarking on this? Where do we see our vision to the future and where are we at now? So you begin to set that out. How do we want to use this? Is it going to be truly a cut and a punishment, or truly are we trying to get to a place where we can use judgment and understanding and creativity and really communication? So that's the first thing you got to do. You got to start talking as an organization. Are you ready for this organizationally? This needs to be part of who you are, your culture. You need to integrate it into it. So it's, again, how do we communicate this? So it's not a flavor of the day and then it goes away. This is who we are. So that's why you want to develop that trust. And then you want to right size this. You want to make sure you have your right standards. So this is where I really encourage you. Uh, this is honestly not a plug for business, but really I am available to talk through with you on how you might think about it, where you might want to start. Of course, you can start pretty simply by looking at your charge description master and sitting down with departments. But years ago, and yes, I am a geek. I will admit that. I ran into a gentleman named Paul Fogel. He wrote this book called Superior Productivity in Healthcare Organizations. Paul and I became friends. I'm actually quoted on the back of his book because I utilized him, and we had a lot of discussions about what this means. But what he was sharing rang true to my belief on how this really spawned what we talked about today, and how to make this right, because outside benchmarking just didn't work. So how did I right size this for the organization? So he was a great mentor along that path, and a lot of my philosophy and development was a result of that. And happy to work with any of you on your personal journey here. But really, it's about right sizing, getting your standards, setting those, and identifying what's the right measure. So I would encourage you down that path. And then finally, this is our last slide, and I'll open this up, is really what's your leadership? So how do you get your leadership there so that you have this opportunity for long-term learning? So you're guiding the staff and hiring, budgeting. Do we really need to replace that position? So it becomes part of what the first things they think of. I think that was probably my biggest, feeling that I've actually arrived when we just utilize this across the organization. And the organization would think about it first. Well, I was looking at my, dashboard, and my FT per unit of service is X, and we aren't quite there. So I don't think I really need a full-time person to replace this. I'm going to, restructure, or we might be able to share services. And those are actually fun conversations. And equally, that they could come and say, our volume's really grown. We need to hire, we need to be in a position to care for this. We're starting to miss our other measurements on timely, getting the patient in by X number of days, whatever it might be, and the data supports it. Real easy decision at that point to say, then go ahead and hire. I mean, let's get moving ahead of that. So opportunities to reassess and refine over time. Again, getting people to be able to come to the table and have conversations. Your takeaways. This is just a final slide on the or this session. So this learning, what senior leadership should understand. Why does this matter? What do leaders in finance need to do? And then the leadership's role, and ultimately, what leader questions should be asking for that ongoing learning opportunity. So with that, I'm hoping that there might be questions that you might want to put in the chat. I will put we do have a couple more series coming up. Be looking for that. Next one's on revenue cycle optimization. Starting to play with a different idea of how to approach this. So maybe we'll do something a little different, just to kind of create something new. And then financial effectiveness and your AR health. So with that, let's take a few minutes and see if there's any questions. If not, any comments you have along the way or things that you would have loved to seen differently, let us know. Again, lifelong learner, want to be able to learn from you all. So great question. I see one from Natalie. How are targets established? Is there a national or state study? I think we need to have them be really institutional, meaning they need to be developed within your organization. Yes, you do have outside national benchmarking. Most of your organization is going to say they're different. So creating them and having your leaders own that space is really equally important. So, for example, like you might think about your emergency department and think about the evaluation and management levels. Those might be weighted, but they know how many patients they saw. That's relatable to that leader. So, good opportunity to really develop it in conjunction with who you are. But always go take that look back. So, good opportunity there. All right, Michael, you have. Let's see how we do this. Hand raised. Go ahead and let's see. How do we unmute? Let's try that. There you go. Should be able to ask your question. Try again. All right, Michael, if you should have opportunity. Yeah, not getting anything, you might go ahead and throw it in the chat. And you're welcome for that. Work RVUs, more for physician time than technical billing. Sometimes definitely for sure. Some areas that might work well, like in your imaging areas, but lab, I would use probably the actual total or RVU, not a work RVU. Again, it's really departmental specific. So good opportunities there, but definitely you want to measure that. In other areas, you might just you might have to create your own weights. And so I don't know if CMS is actually the end all be all, but definitely could be a start for you, Amy. All right, I see one from Jesse Myers. Out of the 20 softwares used that you stated you tried, what one stuck? The one we created independently and internally, Jesse, where we actually sat down with the department leaders and really made it something they understood. My experience, benchmarking is important. I think you always have to be looking. Benchmarking provides you the opportunity to ask why questions, right? Really the in-house and getting that department leader to buy into it is the most critical part, in my opinion. That's where you're going to get the true, uh, ability that they agree to it and then they are willing to track because they understand it. Somebody else's work, they don't understand it. So good question. All right. Any other questions? And apologize, Michael, on your if you happen to be able to just type it in. Let me know what your questions are, or reach out to me independently. But really appreciate the time. Any final thoughts before we leave? Let me know.